My name is Kayla Molina, and I am a street medicine EMT with plans to become a physician. I live in Santa Clarita, California, and work in LA County. A couple fun facts about me. My favorite holiday is Taco Tuesday, followed very closely behind by Thanksgiving with the familia. I have a rescue puppy named Huxley who's about a year old. No, Huxley, please, I just need you to stay still for a little bit, okay? And I'm also a twin, and she is also in healthcare, but no, we're not the exact same person. My biggest inspiration is definitely my family. I grew up in a very big, beautiful Mexican-American family with a lot of vibrant personalities. I have my twin sister, my parents, about 40 cousins. When I was a kid, my mom let my sister and I do the baking soda vinegar volcanoes all the time because it helped clean her sink out. And then when I got to college, I knew that I wanted to study biology because I was fascinated by everything that I could learn. So I threw myself into a bunch of activities. I volunteered at a free clinic. I went on a couple medical brigades, and it was my very first brigade in Nicaragua where I decided that I wanted to be a doctor. I wanted to help out people, and that working within the Latinx community was important to me. And I think that relates to my work right now as a street EMT because I'm able to work with these vulnerable populations. I'm very fortunate to work with a multidisciplinary team consisting of myself and other EMTs, my supervising nurse, as well as substance abuse counselors and mental health counselors. When it comes to street medicine, my absolute favorite piece of advice comes from my supervising nurse, and that's that street medicine is like a bonsai tree. You know, with small interactions day by day with our patients, we're able to slowly affect change in the unhoused community and make progress in their health and in their well-being. I've been working as a street medicine EMT for about 4 months now, and I absolutely love my job. Beforehand, I was working as a personal care assistant for about 3 years, where I was a night shift queen. My background working as a personal care assistant in college has definitely helped me be a better street EMT, because now I'm working with a lot of people with a lot of different unique circumstances, but I'm able to be a little bit more empathetic in how I listen to people and really make sure that I stop and think about each individual person out on the street rather than lumping them all together as just the unhoused community. Every day at my job is a little bit different depending on what different patients we have to see. Some days we're doing coronavirus testing, especially with the pandemic. So for me to stay safe, I always make sure that I have full gown, full scrubs, everything that I need, changing out the masks as much as possible. I usually do the N95 followed by a surgical mask over the top. And then I also have, the face shield. I've got some goggles depending on if I'm doing COVID testing, wound care, depending on what the needs are of my patients that day. I went to Chapman University where I got 2 degrees, one in biology and one in Spanish. I also went to the UCLA Center for Pre-Hospital Care where I got my EMT license. And then I'm hoping also in the future that I can get a master's in integrative medicine with an emphasis in nutrition so that I can better help my future patients really think about the preventative measures that they need to take. The emphasis on proper nutrition, exercise, stress management really became important to me when I was in college and I was training for my very first marathon. And that was the moment when I really saw how proper nutrition really affected my performance as I got up in the mornings, went on my runs, went to work, went to my classes. My 5-year goal is I want to be part of a dog therapy team with my puppy Huxley. I also want to be able to run another marathon before medical school, and then hopefully within the next 5 years, I'm either finishing up medical school or I'm in my residency program. My 10-year goal is to be working in a community medicine setting as a physician. I would also really like to break the world record for fastest marathon dressed up as a doctor. And then my 15-year plan is to make sure that I'm still an advocate for women in medicine and Latinx folks in medicine, especially because there's such a small percentage of us. And I really want to make sure that I'm making this healthcare information and access to proper healthcare accessible to Latinx folks as well as other marginalized communities. I truly believe that I have the blessings and the fuerza of my ancestors behind me as I accomplish all of my goals.